Bismillahirrahmanirrahim. Quote for today is Allah understands our prayers even when we cannot find the words to say them. Today, the topic of presentation is universal health coverage and its financing, and I'm presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outlines of the presentation are introduction of universal health coverage, benefits of universal health coverage, challenges faced towards universal health coverage, approaches for universal health coverage, recent updates, and MCQs at the end. At the end of this presentation, participants will be able to describe the universal health coverage and its challenges that are currently being faced in a country and what interventions can be done to improve health financing system in Pakistan. Universal health coverage means that all people have access to health care services they need when and where they need without financial hardship. It includes the full range of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care. Universal health coverage road. Achieving the universal health coverage is one of the targets the nations of the world set when adopting the Millennium Development Goals in 2015. Countries reaffirmed this commitment at the UN General Assembly high-level meeting that occurred in 2019. Countries that progress towards the universal health coverage will make progress towards the other health-related targets and towards other goals. The universal health coverage emphasizes not only what services are covered but also how they are funded, managed, and delivered. A fundamental shift in service delivery is needed such that the services are integrated and focused on the needs of people and communities. This is the diagram that shows basic pillars that shown. First is the current coverage mechanism. First, the need is extend access to the uncovered, and then services, which services are covered. And third point is reducing cost and sharing fees and expenses. According to WHO, universal health coverage means to ensure that people can use the promotive, preventive, curative, and rehabilitative services they need of sufficient quality to be effective, while also ensuring the use of these services does not expose the user to financial hardship. The definition embodies three related objectives. First is equity in access to health services. Those who need the services should get them, not only those who can pay for them. Then the quality of health services that is good enough to improve the health of those receiving services. And third is financial risk protection that ensures the cost of using care does not exposure of the individuals to risk of financial hardship. Universal coverage brings hope of better health and protection from the poverty of hundreds of millions of people, especially those in the most vulnerable situations. Universal coverage is firmly based on the WHO Constitution of 1948, declaring health a fundamental human right, and on the Health for All agenda, set by the Alma-Ata Declaration in 1978. Achieving the health developmental goals and the next wave of targets looking beyond 1215 will depend largely on how countries succeed in moving towards the universal coverage. Civic space, democracy, and inclusive governance are inextricably linked with the universal health coverage agenda. Who is included or excluded in the health decision making at every level is critical in addressing health inequities. To achieve universal health coverage, being held to account by those who are left behind and those who face discrimination and inclusion is fundamental. Civil society and communities must therefore be included in any universal health coverage plans from the local to global level. Benefits of universal health coverage: it has the potential to make word a reality. Investing into the right for health means lifting people out of poverty, promoting the well-being of the most left behind, and protecting families and communities in the hardest to reach in the areas. Investing in the right to health means lifting people out of poverty, protecting the well-being of the most left behind. Challenges faced are an appropriate resource management, priority setting, and sustainable source of funds from indigenous and international agencies are required. Linking medical coverage with the financial status of the family. Universal health coverage integration with the National Database Organization and Health Management Information System is fundamental. Universal health coverage should also cover the outpatient department. Due to concentration of the hospitals in the larger cities, inequality in the distribution of healthcare services, more public facilities or incentives, investments in the private health facilities to ensure healthcare accessibility in the remote areas. More private hospitals should be empaneled in universal healthcare to expand its reach. Towards the primary health care for universal health coverage and sustainable health financing in Pakistan. The key objective of the mission were to review progress in primary health care and health financing reforms towards universal health coverage and to agree on the medium term multi-partner support agenda, including opportunities to leverage existing external financing. There is a strong and wide consensus that Pakistan must pursue universal health coverage attainment as the driving force for achieving Millennium Development Goals. Nevertheless, several institutional and socio-economic challenges may hinder the progress towards universal health coverage, and the necessary actions need to be taken to overcome these factual barriers that are delineated below. First barrier is suboptimal health indicator. With the GDP allocation consistently of less than 1% for health, what miracles that would expect with regard to health status of population? Although Pakistan's health indicators have improved in the last decade owing to better health awareness, improved access to health services, and women's literacy, these remain behind as compared to those of other neighboring countries in South Asia and Eastern Mediterranean region. The Pakistan Demographic and Health Survey of 2017 to 18 revealed improvements in immunization coverage, antenatal care, deliveries assisted by skilled birth attendants under 5, and neonatal mortality. Maternal mortality ratio has also improved, yet one of the highest in the region. Although the country is well poised to achieve the Millennium Developmental Goals, nevertheless it requires huge efforts at all the levels of health system. COVID-19 pandemic has further contributed to the worsening of health indicators, particularly those related to maternal newborn. Weak health service delivery, the high mortality is predominantly observed among the vulnerable rural population groups to which the state provisioned health resources are the least available. Although the country is one of the best health system infrastructure network, the operationalization of the district health system suffers due to a shortage of qualified health workforce, especially nurses, midwives, pharmacists, and skill mix is skewed towards doctors who prefer to run their for-profit private practice. Universal Health Coverage Index, which is computed as the geometric mean of 14 tracer indicators, for Pakistan has risen from 23 in 2000 to 45 in 2017. High out-of-pocket spending on healthcare. The private sector in Pakistan is the major preferred health service provider of all levels of healthcare owing to the state of public healthcare facilities. The quality and responsiveness are also relatively better. However, the out-of-pocket expenditure remains the biggest challenge. While seeking care without any health insurance or social protection for health, effectively limiting access to essential life-saving health services. Sehat Sahulat Program, Government of Pakistan has launched a social health protection initiative. There is Sehat Sahulat Health Convenience Program, which is catering the entire population of at least 4 out of 6 provinces and regions and will serve as the safety net for the poor, enabling them to access quality care and saving them from catastrophic expenditure on health, as it provides reasonable protection of up to rupees 1 million per year for each household. Prerequisites are, in spite of the fact that Pakistan's political leadership is geared up to achieve the ambitious universal healthcare agenda, There are a few prerequisites that needs to be fulfilled. A is budgetary allocation for health as a percentage of GDP must be increased. Health systems readiness, especially in the public sector, ought to improve in terms of human resources and the availability of essential services. Safety nets for health must continue regardless of the change in the political regime. D is the decrease in the reliance on donors' funding and accountability to be ensured across the board for service providers, managers, administrators, policymakers in the health system. Primary health care for universal health coverage in Pakistan. This joint statement builds on global and regional commitments that place primary health care as the center of efforts to achieve universal health care and health-related Selenium Development Goals. The Astana Declaration recognizes that primary health care provides a platform for accessible, affordable, equitable, integrated, quality primary care and public services for all. Multi-sectoral actions for health and engage people and communities in their own health and well-being. The United Nations General Assembly Political Declaration in 2019 reaffirms that primary health care is the cornerstone of sustainable health system. Primary health care strengthening and health financing reforms are key priorities for federal and provincial government in Pakistan. Improving the coverage and functionality of primary health care is a strategic priority in the National Health Vision 2016 to 25 and provincial health strategies. The Government of Pakistan's Universal Health Coverage Investment Case, that is Universal Health Care Benefit Package, is endorsed by the Inter-Ministerial Health and Population Council, implementing Sehat Solar Program, Health Insurance Program, strengthening multi-partner and multi-stakeholders coordination mechanisms, including empowering communities to enable their meaningful involvement to support the Government of Pakistan to develop a national primary health care for universal health coverage compact. There are multiple plans to upgrade primary secondary health units to materialize. During the past few years, the annual health budget has gone up to rupees 65 billion from 35 billion, and the bulk of amount was being spent on the salaries of staff and equipment. What can be done to strengthen district governance, achieving progressive increase and diversification of universal health coverage financing, prioritizing and community and primary level, ensuring equitable and resilient access to healthcare services, including thorough innovative strategies for hard-to-reach populations and behavioral change interventions, and improving healthcare quality in both the public and private sector by implementing accountability and performance frameworks for both the public and private sector, and strengthening the role of Health Commission in this. Sehat Card Plus program is a micro health insurance program for all citizens of KPK. It's one of the flagship of the programs for the government of KPK. The program is being implemented through insurance companies selected through national competitive bidding. Data of beneficiary families is acquired from NADRA. Services to be beneficiaries are offered totally free without out-of-pocket payment, up to a maximum limit of 1 million per family per year. Annual cost of the program is around 18 billion. Services to the beneficiaries are provided through a panel of public and private hospitals contracted across the province. Global progress is that to accelerate global progress, we need the primary healthcare services to be strengthened. First key point is increasing health system resilience. A health system's ability to identify and respond to emerging health threats is central to its resilience. Since the emergence of COVID-19, it was partnering with the countries to adapt and transform their pandemic response measures into sustainable national, subnational, and local interventions. Investing in subnational health system. The real-time data that these services and systems provide to the health officials improve subnational and leadership and decision-making on resource utilization, human resource for health, supply chains of family planning, reliable access to oxygen as part of the comprehensive respiratory tract system, packages, contraceptives, self-care, HIV self-testing kit, health insurance coverage, and overall health indices and outcomes. Digitalizing health system. The greater insights and the capabilities offered by the stronger digital and data system enables policymakers and providers to target precious healthcare budgets and services for highest impact. Prioritizing self-care. The WHO defines self-care as the ability of the individuals, families, and communities to promote health, prevent disease, maintain health, and cope with the illness and disability with or without the support of a healthcare provider. Focusing on the people-centered care. People-centered care incorporates the desires and needs of the individuals and communities into the design of health infrastructure and services. This results in the health products, policies, and systems that are more inclusive and of higher quality than those currently available. Recent updates. An article recently published in 2023 shows the universal health coverage in Pakistan is the health system geared up to take on the challenges. Background of the article shows there is a strong and wide consensus that Pakistan must pursue universal health coverage attainment as the driving force for achieving sustainable developmental goals by 2030. Nevertheless, several institutional and socio-economic challenges may hinder the progress towards universal health coverage. Concurrent, this COVID-19 pandemic has revealed some major gaps in the health system's capacity to deliver equitable health care, which is a cornerstone to achieving the universal health coverage agenda. The priority setting process will need to be aligned with the Selenium Development Goals to ensure that the agenda for action towards 2023 is comprehensively addressed and successfully accomplished, but hopefully not beyond the target dates. Universal health coverage according to WHO. Key facts are the universal health coverage indices increased from 45 in 2000 to 68 in 2019. About 2 billion people are facing catastrophic or improvising health spending. Inequalities continue to be a fundamental challenge for universal health coverage as aggregated data masks within countries inequities in service coverage. The COVID-19 pandemic further disrupted essential services in 92% of the countries at the highest pandemic in 2021. To build back better, WHO's recommendation is to reorient health system using a primary health care approach. Most or 90% of the essential universal health coverage interventions can be delivered through a primary health care approach, potentially saving 60 million lives and increasing average total global life expectancy by 3.7 years by 2030. Coming towards the MCQs, first MCQ is Universal Health Coverage Essential Package for Health Services is a policy framework for strategic services provision based on scientific evidence on health interventions. Who has a part to play in advocating for universal health coverage? First, option A is non-for-profit organizations, option B, citizen groups, option C, health workers, and option D, every member of the society. Option D is the right one. Second MCQ is Pakistan can overcome these challenges that are faced by the universal health coverage and build a healthier future for its population. What does universal health coverage means? It means option A, all individuals and communities receive the health services they need when and where. And option B, prevent people from being pushed into poverty when paying for health out of their pocket. Universal health coverage option C enables everyone to assess the services that address the most important cause of the disease and to death. Universal health coverage is option D is about health services for individuals and population, such as controlling mosquito breeding grounds. Amongst these, option A is the best one. Third MCQ is Government of Pakistan has launched a social health protection initiative. It can bear the cost of about option A 1 million per community, option B 2 million per single people, option C 1 million per household, and option D 1 million per 10 people. Option C is the right one, 1 million per household. Fourth MCQ is primary healthcare provides a platform for accessible, equitable, reachable and affordable primary care and public services. This point was declared by option A, Alma Declaration, option B, Astana Declaration, option C, Dosti Declaration, option D, Sehat Card Facility, and option E, Sahulat Program. This point was declared by option B, Astana Declaration. Fifth MCQ is universal health coverage accords that in access to health services, those who need the services should get them, not only those who can pay for them. This comes under the umbrella of which of the following? Option A, equity. Option B, equality. Option C, quality enhancement. Option D, justice. Option A is the right one, equity. Sixth MCQ is universal coverage is firmly based on the WHO Constitution of 1948, declaring health a fundamental human right, and on the health for all agenda set by which declaration? Option A, Alma Ata Declaration. Option B, Astana Declaration. Option C, Dosti Declaration. Option D, Sahulat Card Facility. Option E, Sahulat Program. Option B is the right one. Option A is the right one, Alma Ata Declaration. Seventh MCQ is Universal Health Coverage Index, which is computed as the geometric mean of 14 tracer indicators of health service coverage for Pakistan, has risen among the year 2000 to 2017 on the scale of 100 as option A from 15 to 20, option B from 12 to 21, option C from 23 to 45, option D from 18 to 32, and option E from 40 to 57. Option C is the right one, 23 to 45. Eighth MCQ is the Pakistan Demographic and Health Survey of 2017 to 18 revealed improvements in the immunization coverage, antenatal care, GDP declaration for health system is option A 2%, option B about 3%, option C 4.2%, option D 1.7%, option E less than 1%. Option E is the right one, less than 1%. Ninth MCQ is a set of evidence-informed prioritized health interventions, services programs including intersectoral actions and fiscal policies defined through a deliberative process that accounts for economic realities and social preferences is option A universal health care coverage friendship package, option B universal health coverage benefit package, option C universal health coverage home package, and option D universal health coverage intersectoral package. Option B is the right one, benefit package. 10th MCQ is Sehat Card Plus KP is a micro health insurance program for all citizens of Khyber Pakhtunkhwa. For this program, data of beneficiary families is acquired from option A government papers, option B NGOs, option C organizations, and option D NADRA. Option D is the right one, data is collected through NADRA. This is the key of the MCQs, and thank you.